It is such a delightful occasion to have the opportunity to gather together in person once again after the 2+ years that we've been through as a society, as a community, as families and individuals. We don't take for granted that we are able to gather here, doing so safely and responsibly. And I want to just extend a special thanks to each and every one of you for choosing to come out tonight, knowing that we still need to be cautious and cognizant of the challenges that still face us. But thank you. So please give yourselves a hand. And thank you to those of us in our virtual audience who are joining us because this is such an important topic. And we commend Catalyst for taking on the challenge of understanding more about the mental health challenges that face us as individuals, as communities, as families. The Hartford Foundation for Public Giving for many years has supported mental health services and access to mental health services in the greater Hartford region. And as you can imagine, that support increased significantly at the onset of the pandemic. In the early days and throughout the pandemic, our COVID response fund provided resources for the reopening of mental health services, to assist those organizations to get PPE and medical equipment that was necessary to conduct telehealth services at a time when they were very much sorely needed. We've also worked with some of the Greater Hartford Alliance school districts. We know schools play an important part and a central role in the academics and the education of our young people, but they also understand that they have to deal with the whole person. And that whole person of a student often involves their family. So making sure that there is access for our students and often their families at the school district level is something that we've also provided support for as a result of the generosity of our donors. And last year, we invested $10 million by partnering with the City of Hartford and Dalio Philanthropies to assist disengaged youth, young people between the ages of 16 and 24 who are not involved in the educational system, supporting 3 nonprofits who are providing trauma-informed mental health services and support to our young people and their families. So again, each and every one of us, I'm sure, if not ourselves, someone in our family or someone close to us has encountered challenges when it comes to mental health, and there is often such a stigma attached to it, but as human beings, none of us can escape the impact. So again, we are thankful and commend Catalyst for taking this issue on. So thank you for joining us. I am happy to be back here in person, and we look forward to an opportunity to continue to engage in a safe and productive way. And with that, I turn it over to Terry Schmidt.
I'm not as tall as Jay. I'm not as a lot of things as Jay, to be perfectly honest with you. Betty Ann told me that I was going to take over for Jay at the podium. And the first thought that went through my mind was, nobody takes over for Jay Williams. I said, that's not possible. So Jay, thank you again for being here. I am always thrilled to see you participating with the Catalyst Endowment Fund operations. We learn a lot from you, and obviously you've learned a few things from us, and that's a thrill. So again, my name is Terry Schmidt. I'm the head of the steering committee of all of you. I'm just helped set the agenda, but I'm here tonight to welcome each and every one of us to this event, especially those of us that are guests that have come for the first time. And if you're guests online, that's wonderful, that's spectacular. You get a chance to learn a little bit about what Catalyst does, and we get a chance to invite you to join us. This year, as in every year, this first session is at a time that we do invite guests to come, and I'm told by Betty Ann to remind everyone that if you're a guest and it's your first year, you get in for half price. It's only $250 of a donation, rather than the regular $500 a year. But those donations all matter. They've accumulated. The Catalyst Fund, which started almost 30 years ago, next year will be the 30th anniversary. The Catalyst Fund has now over $1 million as a fund that backs up our donations every year. The advantage with that is, and we'll learn more about this as we go along, is that we started out many years ago giving about $10,000 to $12,000 a year. This year, we expect to have $60,000 to give out to a deserving nonprofit, or several deserving nonprofits. So I'm glad that everybody's here. I want to introduce our panelists. It is just wonderful that each one can be here, and I'm going to warn them. I'm going to talk to you now, but let me first do the introductions of this. First here is Liany Elba Arroyo. She is the director of Hartford's Department of Health and Human Services from the city of Hartford, but I bet she knows things about our whole region as well. And next to her, Dr. Melissa Santos, the division head of pediatric psychology at the Connecticut Children's Medical Center. Welcome. We're glad that you're here as well. Kim Stevenson, next to her, founding member of the Friends for Equity in the Avon Schools, which is marvelous operation. We're going to hear more about that. And next to her, my favorite about all the panelists, I'm sorry panelists, but this is just true, Caitlin Garcia-Stevenson, who is a student that initiated a program for mental health delivery in the Avon High Schools, the Avon High School Voices for Equity. So thank you all for being here. You're going to get to do a much better job of explaining what you do than I just did. And that's what we're going to go on. So we're going to do about 5 minutes. I say that, it says 5 to 7 minutes, but try 5 minutes of what you're doing and what you care about and what you can tell us. Each of you will get 5 minutes, and then we'll open it up for some questions and answers from our audience online as well as our audience here. So you might want to start thinking up some questions, or you may have questions that come into mind quickly. Write them down so that you can give it to us succinctly. When you do, I will say this, when you do that, Betty Ann, I think it's going to be Betty Ann, will be wandering around with a microphone. You can raise your hand, I'll call on you, but wait until you get the microphone. Because if we don't have the microphone, if you don't have the microphone, and by the way, it's not magic, you can't just hold on to it. You have to put it up to your mouth. If we don't have you on the microphone, the people at home who are watching this, and there are plenty of them, won't be able to hear you. So Betty Ann will wander around for that. Okay, are we clear? All right. Liany, is it right?
Liany.
Be my guest.
Thank you. It's pretty exciting to be here. It's, I believe, my first in-person presentation in over 2 years. So I'm going to be quick and keep my eye on the time here. I'm here to talk to you a little bit about COVID-19 and its impact here in the city. COVID-19 really overall in the state exposed the deep inequities that have existed for many decades. We're in public health for over 2 decades, and I've been working on these issues for over 2 decades. And it was, I think, pretty surprising to many people that these inequities existed in the state, but it wasn't to those of us that have been in this field. And so one of the things that I always kind of remind people is, despite the wonderful health rankings that we have as a state as a whole, when you dig down deeper, that's when you really start to see the differences between different populations. Urban, suburban, but also by race, by income. And many of you are probably familiar with that wonderful Alice report that the United Way does that breaks that down. But these inequities have existed for many decades here in the state. And what did those inequities look like pre-COVID? Because that's where we have the best data from. So we know that uninsurance was pretty high, particularly amongst the Latino, Latinx population. So here in the state, uninsurance for the non-elderly was at 7%. For Latinos, it was at 14.4%. We know that low birth weight babies in 2020 for all races was at 7.8%, but for the non-Hispanic Black population, it was at 12.5%. And this is for Connecticut. We know that deaths to firearms in 2020 overall was 5.3 per 100,000 individuals in our state, but for the non-Hispanic Black community, it was 13.1. Deaths due to diabetes in 2019 overall for the state was 15.6 per 100,000. But for the Black community, it was 26.9, and for the Latino community, Latinx community, it was 22.0 per 100,000. When we look at obesity, bringing that one up because we know of the very close tie related to COVID-19 and outcomes as a result of that. Amongst all adults in our state in 2020, 25.5% of them presented as being obese. Amongst the non-Hispanic Black community, it was 41.1%, and amongst the Latino Latinx community, it was 38.7%. Among adults reporting not having a personal doctor in 2020, amongst the Latino population, it was 30.7%. Our Black population here in the state, 16.3%, and our Asian Pacific Islander population, 16.2%. That's compared to 12.7% of all Connecticut residents. So these inequities didn't spring forth because of the pandemic. They've been here for many years or many decades, as I said. And if you were to overlay a map, when we talk about redlining and zoning and all of those issues, against any of these many conditions that I've spoken about, there's usually a nearly perfect overlay. And so these issues that manifested themselves more fully or became more in the media and more to the attention really had been there for people sort of under the surface, not necessarily realizing it. And they're tied to deep structural issues in our communities. So as we think about COVID and how these things manifested themselves as it relates to COVID, here in the city of Hartford since March 2020, we've had nearly 32,500 positive test results. There are some people that have gotten it twice, but not many. But again, so you can probably say nearly 32,500 residents. We've had 424 residents that have passed away. That's 1 out of every 298 residents in the city of Hartford. African Americans, again, remember we talked about diabetes and as we talked about obesity, have been disproportionately affected by deaths in our city. Latinos have had the highest number of positive cases, and even though our data in terms of cases is rather incomplete, nearly 40% of data often on race and ethnicity was missing during the pandemic as we were trying to move resources around. We feel fairly confident in saying that a vast majority of them were likely Latinos based on last names when we're going through looking at the numbers. And so, questions become why? Why did this happen? Well, we know that many of our residents here in the city could not work from home. They were in the office. They were deemed essential workers, even though oftentimes people just passed by them, not even thinking about them. We can see here in the city sort of the way the pandemic made its way through the city, starting in the North End, where we got our first case, heavily African American, West Indian, and spreading to the South End as many of our North End residents work in healthcare, nursing care. They receive many protections initially to protect the residents they were caring for, and then as the economy started reopening fairly quickly, I think most people think we were shut down for a long time. We were not. We never really fully shut down. But as restaurants started reopening, we started seeing more of those cases move and spread down to the South End. So as the hospitality started opening up and things like that, we saw that happening. In terms of children, we've had 6,500 children ages 0 to 19 that have been diagnosed with COVID here in the city of Hartford. The majority of those have been Hispanic, followed very closely by the African American population. Again, 40% are unknown in terms of their race or ethnicity, but based on last names and the addresses and our knowledge of the city, we think the vast majority of them are likely Latino, with large numbers of African Americans mixed in as well. Amongst 10 to 19-year-olds, fairly similar data, 16.6% of the children that have been diagnosed have been African American Black, and 30.7% Latino Latinx, 43.5% unknown. In terms of deaths, unfortunately, there have only been 2 deaths in the state of Connecticut from 0 to 9-year-olds, and both of those deaths happened in the city of Hartford. And so we have a lot of work to do when we look at vaccinations. Just 1 more minute and I'm done, that's it. And we continue to do that work. We've done that, some of that work with support from the state and also support from the foundation. And so we continue to make sure that we're reaching all populations with door knocking campaigns and a whole host of other issues. But the impact on our children, I think Many of you have read the current and have seen, but we also know just nationally what we're reading and hearing from the Surgeon General's report, that 25% of youth experience depressive symptoms, 20% experience anxiety. In 2021, early 2021, ER visits for suicide attempts were 51% higher for adolescent girls, 4% higher for adolescent boys compared to the same time period in 2019. And the risk factors that contributed to that, to children having and youth experiencing these mental health challenges, was having had mental health challenges before the pandemic, living in urban areas, in an area with a more severe COVID outbreak, check for the city of Hartford, having parents or caregivers that were frontline workers, another check for the city of Hartford, having parents or caregivers at elevated risk of burnout in terms of parenting demands, I would say another check for the city of Hartford, experiencing disruptions in routine, though our city schools opened fully and on time for in-person learning, more than half of the children in that first year did not show up for in-person schooling. And we did have a disruption later on. And then experiencing more adverse childhood events, again, another check for the city of Hartford, and then experiencing more financial instability, food shortages, or housing instability. So our children lost parents, they lost days in school, they lost access to their friends, and they lost their safety net, which was school. And so the full impact of the pandemic is going to be is still yet unknown on both the physical and mental health of our children. But I want to end this by saying that while all children felt this pandemic, some felt it much more acutely. And those were the ones that were already experiencing trauma and had numerous needs. And unfortunately, it took a pandemic of this nature that affected every child and their mental health for the spotlight to be put on this issue. But I would challenge everyone to think beyond the pandemic. I challenge you to think about the structures and policies that led to this pandemic affecting Black and Latinx communities and Native American communities much more deeply than others, and think about how we can address those issues so that we can create the resiliency needed for communities like Hartford to be better prepared for the next pandemic. Thank you. Thank you.
So I get to ask one question before we move on to our next guest. And listening to the presentation, which was, I was very impressed with the amount of statistics that you had to share with us and how painful they are, to be perfectly honest. And other folks are going to have a lot of questions in depth, but I was thinking there's just so many, it's just a plethora of things that are facing some of our youth in the city of Hartford right at the moment. We're here to try to pick an agency that can do something to make things better. So out of this whole long list, I mean, the things that affect their mental health, the parents that are frontline workers, the violence that's around them, the housing problems, the fact that they are breathing the dust and all that. If there were one thing that quickly that you could say, if there were one thing I'd do tomorrow, what would it be?
Oh, wow, you're putting me on the spot with that one.
Yeah. Yeah.
I firmly believe that health is intimately related to a number of things. And I would like to think, although my colleagues in public health would say, you have to say public health, I would say investing in economic mobility. And true economic mobility helps a whole host of things. And so if I have to think about the big picture, and public health is about the big picture, it would be investing in that, because that has ramifications far beyond a salary. It allows upward mobility for housing. It allows access to better jobs, access to health care. I think all of that is critically important.
Okay, thank you very much. Melissa, you're up next.
Stay here.
You can do whichever you want. If you want me to be stuck standing, then that's fine.
I'll let you sit.
Okay, and come on. Okay, thank you.
So hi, everybody. So I was trying to figure out how I could spend my 5 minutes with you conveying what our experience has been like at Connecticut Children's. But I realized that many of you probably know what our experience has been like at Connecticut Children's with the mental health system, because we've been on the newspaper a whole lot. So is anybody not familiar with what's been happening over at Connecticut Children's in terms of the mental health of our kids? Oh, I'll tell you. So one of the things that we know, and I think you heard it and you'll probably hear it throughout, is that COVID did nothing but really spotlight problems we had long before COVID ever initiated. We talk a lot about our mental health system. Our mental health system has been broken for so long It was broken before the pandemic, it's broken now, it's gonna be broken for some time until we can finally fix it. What COVID did was really show everybody and sort of turn the volume up of how just broken it is. We talk about racism in healthcare, those inequities, those existed for a long time. COVID just let us see it kind of full out. So since the start of the pandemic, we knew that we were in for a little bit of a different experience with our kids over at the children's hospitals when we started to admit a lot of kids for eating disorders. So in the first several months of the pandemic, that's when we were hospitalizing a whole lot at Connecticut Children's, were teenage girls that were starting to develop eating disorders. And it was really interesting to talk to them because you really got this perspective of what we were getting into in terms of the mental health impacts of COVID. Life changed. I don't know how many of you remember those first days of the pandemic, but those kids described it so well. I went to school one day, I came home, I did my homework, I did my after-school activity, I ate dinner, and the next day I sat at home. And life completely changed from that point on. And this went on for now, I mean, what, we're 2 years? 2 years? 2 years now, and we're still kind of doing this. Every day is a little bit different, and anybody cringe when they turn on the news and you're like, oh, what's happening now, kind of thing. And that's what our kids have told us. So we've seen an influx throughout our hospital for kids with mental health disturbances. In our medical floors, kids coming in with eating disorders, kids coming in that we're having to hospitalize because they have all sorts of pains, seizure disorders that are brand new, that we know probably have a mental health impact to them. Our emergency room is probably what's received the most news coverage, as kids have had to come to the emergency department because they've been unsafe or parents have been worried about them. And then throughout all of our outpatient clinics, so we're fortunate to have psychologists and social workers throughout our Connecticut Children's outpatient clinics, we've seen throughout there kids and more families accessing or trying to access care for their mental health. One of the things that we're really trying to work on at Connecticut Children's is we know that there's many opportunities, but we also know there's a lot of limitations. So telehealth was great. When we initially all had to stay at home, when we were worried about bringing kids into the hospital, telehealth was great. Unless you lived in Hartford, you didn't have access to Wi-Fi, you didn't have a computer that had smart technology. I mean, for a long while, kids in Hartford were being given Chromebooks to do school, and then they realized that they didn't have the Wi-Fi at home to actually connect to use those Chromebooks, or Chromebooks to actually do the learning. And we know that during that time, we lost a lot of families to services and receiving medical care because they couldn't convert to telehealth appointments. And that was a real struggle to keep kids engaged in the mental health during that time. We know that prior to the pandemic, and even now throughout, we just don't have enough A, workers, and B, enough of an actual true continuum of care for mental health. Right now, we have a lot of, well, we don't have a lot, but we have inpatient beds, we have the emergency department, and then we sort of have outpatient, but we don't have those certain levels of care that kids really need so that they can get the right care at the right time. We have kids sitting in the emergency department because they need an inpatient bed, but kids are sitting in inpatient beds because there's nowhere for them to go from inpatient to receive ongoing care. And there's no more outpatient therapists available because everybody's got a really long wait list and isn't taking any more patients. And so now we have a complete oversaturation of the system, and that's even if you know how to navigate the system. I won't ask you to do a show of hands, but if anybody's ever tried to navigate the mental health system and find services for their child or a loved one, it is not an intuitive or an easy system at all. So you have to have some skills in order to be able to do that. One of the things that we are working on at Connecticut Children's is we are trying to build an inpatient unit, really focused on kids that have both medical and psychological concerns, because we know that they're a unique population that oftentimes have a really hard time finding services. So for example, if you're a teenager who has diabetes and as a result of your depression and your anxiety, you can no longer maintain your diabetes regimen, and now you're getting sick and you're going into medical conditions as a result of no longer being able to control your insulin, and you still have that depression and anxiety that's so bad, there's not a lot of programs that'll take you to help take care of that. And so our hope is that we can build an inpatient unit really dedicated to those kids, as well as an intensive outpatient program, so a multi-day, multi-hour program, so that kids aren't stuck on an inpatient unit, they have somewhere else to go, as well as create our workforce of workers on outpatient. And now we've created a continuum, which is really what we need to develop for our children and families, where kids can get more so that they don't end up in our emergency department needing the highest level of care. But I think the thing that you're going to hear, and hopefully I think you'll hear throughout, is that the systems that we have in place, the mental health system, the systematic racism, the health disparities, the health inequities, these have been here for a long time. And as we try to create new systems and try to create new treatments to really help our kids with their mental health, I think we have to be cautious to make sure that we're not continuing and perpetuating those inequities as we develop and really want to rush to help kids in this state. Did I do good under my 5 minutes?
Yeah, you're good.
Yes. Thank you.
I'm gonna go down there, I think, from now on. Okay. So, instead of that, that's good. That was excellent. This is gonna go off on me. Oh, well. So when it goes off, I'll turn it off. So thank you. The sort of the medical, clinical perspective on what's going on. See, I told you it was gonna go off. Let me ask you a question then, because a lot of what you were talking about was an issue of resources.
Yeah.
And resources, it could be thought of as a hospital bed, it could be thought of as a program somewhere, it could be thought of as the people that can provide the program, could be thought of even as the educational system that trains people so that you have them available. We support nonprofits. That's what we do. We select those kinds of things. Can you think of a nonprofit or an area of nonprofit work that could make an impact on those resources? What would it be?
So I always think that we need to have mental health services and mental health support in every setting that a child goes to, from school to after-school programs to religious organizations to your dentist office to your sports leagues. I think that oftentimes there is still a stigma attached to mental health, particularly when we start talking about our Black and brown population, where it is viewed as being stigmatizing to still access mental health services. And so oftentimes where I think about where do we sort of place those resources are going to have to be in those places where our community really feels safe and comfortable, be that at a religious organization, at a faith-based organization, or some other community type setting that is in the community that we are trying to target, because I think without that, we don't get the buy-in for people to feel comfortable to access those services.
So you want us to target places that bring with them a sense of legitimacy
Yep.
for the population?
Yeah, because I think otherwise it could look insincere to some people.
Excellent, thank you. Kim Stevenson, come on up. I'm gonna go down here this time.
And you'll be before me, please, because then I don't go over my 5 minutes. Hi, good evening, everyone, and I really appreciate being invited to speak today and talk about these issues that are really important to me. I'm not going to talk about COVID, but everything that has gone on with COVID is just another layer of complexity on top of the things that I'm going to talk about. So I'm a mom. I have 2 girls who are 16 and 18. Caitlin here is my youngest daughter, who were raised primarily through the Avon school system. They're multiracial and multi-ethnic, so they're English, Dominican, Black, white, English. I'm obviously the white part of that equation. And as a working mom, really, my life was divided between my work and my kids and raising my kids. And they identify as students of color. And most of their friends have been other students of color, either in Avon or Avon students from Hartford. And so that was the group that we flowed with, kind of as they went through the system. And I had a front row seat to their lives and the challenges that they were grappling with. It was after George Floyd's murder in May of 2020, kids, many parents and teachers were waiting for some kind of acknowledgement from school leadership about what had just happened. So that happened in May. It actually wasn't until July that we got a letter from leadership that came out to parents and the community that really sort of implicitly referred to the events that had happened And it felt like a defensive statement regarding what the school district was doing and planned to do regarding equity, rather than really a visionary statement and an acknowledgement of support regarding this horrific event. That letter was read at a Board of Education meeting, and Caitlin and I sat and listened to that. And I acutely remember the precise spot, the precise, where the lines were at that CVS in Avon, where we were sitting and listening to that. And Caitlin broke out into tears, just like uncontrollable tears, in a way that I had never seen her before. She's not an emotional child, and she's allowed me to say this in front of you all, in a way that I'd never seen before. And I honestly thought that I was gonna have to take her to the hospital. I mean, it was traumatic. And the only words that came out of her mouth were, "Why does somebody have to die for them to pay attention?" And it was at that moment that I knew I couldn't stand by and watch any longer. Because of who my family is, I'm privy to multiple worlds and just acutely aware of the othering that is experienced by many students of color in Avon, the microaggression, the overt ugliness that happens to both students of color and kids who don't fall within certain cultural norms. Some examples, it was a school dance. The kids were all upstairs in the house, about 5 or 6 girls, black and brown girls, including my daughters, getting ready for the school dance and openly talking about why did none of the boys invite us to the dance. I'd recently spent a good part of a day and evening with a student and family friend. It's an Avon student from Hartford who'd been put in a locked cell at the Institute for Living, where we sat together and cried and hugged each other till I had to leave. And it was really nothing more than the teenage overload of managing life, school, friends, relationships, and the daily pressures of code switching that had brought her there. So she's fine now, but where was the community support and an understanding of the variables that had brought her there? She'd left Hartford to come to school in Avon. That was her new adopted community, but where was the community to support her? So a group of us started Friends for Equity in Avon Schools, including Julie McNeil, who's in the back here, who invited us, brought us here today. We met through an anti-racism program that was held and sponsored by the Avon Public Library in the summer of 2020, and just kind of grew from there. So we're a group of Avon parents and residents advocating for an inclusive school culture that welcomes diversity and values racial equity through connection, education, and community connection. And community is so important. We came together to own the lack of diversity, equity, inclusion in Avon, and the lack of organized leadership to address this issue. We organized to fill this gap and try to improve the situation. We formed in the fall of 2020. We currently have 250 members and followers. And as parents in a majority white, and that's this group here today, I think, but diversifying community, we believe it's important for all of us, and in particular, the white folks, to own our responsibility to educate ourselves about equity, anti-racism, and support and act where needed for our kids. We've been doing a lot of work, I'm just gonna say one more thing, and then we've been doing a lot of work in the Avon community and really have become, a force to be reckoned with and paid attention to. And one of the things that I would say is that many of these issues are being battled around diversity, equity, and inclusion. The battleground is the suburbs, and we have to take on this battle in the suburbs. Our communities are diversifying, and I think we're going to see much more ugliness in the upcoming elections, and just really encourage everyone to get involved, speak out, and become a part of protecting our kids and making sure that we have the communities we'd all like to see.
So I think we're all fascinated by the fact that this comes from Avon, as you say, a majority white suburb. Some of us also live in majority white suburbs. They're not hard to find, to be honest with you. I'll just speak from sort of my own experience of cluelessness. Say we are interested, we're willing, but we don't have a clue. We don't know what to do. What might you suggest in terms of a Simsbury or a Glastonbury or a Manchester? Manchester's not majority. I mean,
So-
how would you give us guidance to start?
So there are groups actually forming in every one of those communities. Simsbury has a couple of groups that you can get involved in. Manchester has some really active groups and have done a lot of work around equity audits in their school. Glastonbury has some active groups there. So it's I don't know, I can tell you where they all are, because one of the things that we did was before we got started, we researched what was going on in every community so that we could learn and we weren't reinventing the wheel. But this is actually, this question of what's needed, there's lots of different groups all over the place trying to do this work, volunteers, passionate, but it needs to be supported. There needs to be a platform underneath it, supporting it all, so that, you know, these kind of things can it's easy for you to find that.
Excellent. Thank you. Thank you very much. Well, Caitlin, tell us your story.
Hello, my name is Caitlin Garcia-Stevenson, and I am an observant person. Growing up in an intellectual, socioeconomic, and culturally diverse background, many things in my life contradicted each other. Leaving me with lots of observations about the world. It was about 6th grade that my observations about social etiquette and different cultures prompted me to ask the question, how am I supposed to act? Because if you did not conform to social etiquette that was deemed appropriate in said environment, you became an outsider. So imagine growing up in a predominantly white school where if you speak in a certain vernacular, people will see me as my stereotypical Latino stereotypes, making me an outsider. Thus creating friends was very difficult. School to me was not a place to learn. It was a place to put on a performance to make people comfortable enough to give me the opportunity to prove I am more than my stereotypes. At the same time, growing up in an environment where bragging about grades is a part of culture, school was not easy for me. I was a kid sectioned off from the rest of the class, receiving extra support, and that solidified to me how alone and different I felt. Deciding that I am the problem, I tested off having extra support and committed to the role of who I was going to be in school, causing self-worth to be a direct correlation to how well I could act that day and how my grades were. Towards the end of middle school, I became emotionally drained and depressed. I had to miss a day of school almost every week because I could not physically go. When I'm stressed out, I research, and then that's the only thing that can calm me down. I learned when you are a female ADHD/dyslexic person of color, you're more susceptible to depression, stress, and anxiety. This understanding gave me the self-confidence to recognize it is not my fault the system did not accommodate to my identity. Coming into a freshman year of high school, I started having conversations with minority students in the school, noticing that they were dealing with the same issues I was. Realizing inequities in our society makes it so that certain people are more susceptible to mental health issues. It felt like nobody was going to change the environment, so we, the students, had to be the voice had to have our voices heard. A group of my peers and I started Avon Voices for Equity to make the inequities in our school apparent to the community. Being a junior in high school, I noticed the biggest challenge one faced when doing advocacy work is how to make people empathize with the issue that don't directly affect them. My approach to that challenge is emotion. Because of who I am in a certain environments, I'm more susceptible to excluded in all the associating emotions. I'm presuming everybody in this room has felt emotions I'm talking about. So when talking about racial equity and mental health, we all felt the fundamental emotions that people of color feel when dealing with prejudice and racism. Thank you.
So I was interested in the notion of turning a problem into an opportunity that you presented. So could you just tell me a little bit about how your advocacy has made you feel?
Well, the main reason of why I do advocacy work is because I'm really angry about how my school has not really taken into account the inequities that people of color and minorities face in the school, and it was an opportunity for we the students to go and make our voices be heard, and I feel like in this conversation it's really hard for our voices to get heard and like for what our true intent is to come across. So it's an opportunity for us to A, get more involved in the community, and B, for our true message and our true statements to be seen in the future in actions.
Okay, thank you. So now we have a time of questions. Questions and answers from you, so you should be thinking up, if you haven't already thought up your questions, go ahead. And Betty Ann?
I'm going to come around with the mic, but before we start questions, could I ask one question of the panelists? And I'm not sure who it's of, but many people coming in tonight have seen articles about mental health in the news lately. Many of us have been reading about what the state legislature is doing in regard to mental health. Can one of you speak to that, to new legislation that's sort of pending right now in the state capital?
So I can try. There's a lot going on in the state. I think the bill that made it through the House yesterday was 96 pages long. But the idea behind a lot of the legislation that's going through right now for mental health is really to open up new opportunities for care, particularly to enforce the school workforce for mental health, to provide more care to kids in crisis, so that there are more opportunities for that. It's to develop our workforce so that we can have more healthcare workers dedicated to mental health at all levels, at multiple settings. And I think to create new opportunities for care so that there's many different layers of care. So I would say broadly that's sort of what it's: new workers, new treatments, supports in school.
Karen, I'd
Yeah.
like to remind you, after a Catalyst member or guest asks a question, if you don't mind repeating the question, it will help the live stream deliver the sound better.
Okay,
This
let's.
microphone is not hooked up to the live stream.
Oh, okay, so I'll definitely repeat it if I remember it.
Hi, everyone. Great to see everyone again. This is wonderful to be out and about again, and I feel your pain having your first presentation after 2 years. You do that, but thank you all for giving your perspectives, and Caitlin, thank you for telling your story. You got a long journey ahead of you, lifelong journey, but glad you're in front of it. Dr. Santos, we talked about trying to get the services to deliver to where people are, where the kids are. We're learning about killing and what they did again last night. And it's a sad commentary about that. What I don't know is how many schools are actually delivering in the high school and what that number is. We've got 169 towns in this town, in the state, but how many are actually doing that work And is this a unique situation, or, I hate to say, is this something we're going to see repeated 169 times?
So the question at hand, which I'm just repeating, I think you got it, is in light of one town in Connecticut that has apparently repeatedly turned down a free program for mental health services in the school. There are 169 towns. How many others are turning down these kinds of services? Or maybe flip it on its head. How many school systems are providing mental health resources of one form or another to their student population?
So it's a great question, and it also reminds me that the legislation has some stuff around school-based health centers as well. So it's a hard question to answer because there are a lot of towns that do offer mental health services within their schools, within their high schools, but whether or not they have enough workers for the number of kids that need help, I think is the greater question. I think where we have gotten worried about what is happening in that town that has repeatedly turned down services is that as we start to talk more about mental health, children's mental health, racism, health disparities, health inequities, whether or not it almost develops sort of a backlash of people sort of feeling like it's being talked about too much. It really doesn't need to be addressed. It doesn't, there's other ways to do it, and kind of the backlash focus of it. So there are towns, many towns do offer, most do not have enough for the number of kids that need help. And I think we're particularly concerned about what is happening in that town and whether or not that might reflect what will happen in other towns as there's a backlash towards the focus on this.
I will say, as a former Board of Education member, the spotlight that's on the situation now is a positive thing because that puts pressure on Board of Ed members to support systems. What I was going to say is, as a former member, unfortunately, mental health services were one of the things that could be on the chopping block. They weren't at the top of the priority list very often, and so all of this attention is making it easier, actually, for some people, some Board of Eds, to take action, which is a good thing. So,
Great.
All right, Betty, you've got another. Oh, Bob.
Many in this audience may have a similar issue that both Jane and I have. We have two grandchildren who have gone through a mental situation over the past 2 years. I'm very familiar with what Dana was addressing. Thank you. We thank Catalyst for addressing it. I guess my question is, and it's kind of a continuation of what Dr. Santos, Gary asked you, and then Gilbert just did, and that is that the state was $100 million designated. We now, as a nonprofit, have $60,000 to offer. And I guess, a follow up with Gary asked, what would you suggest would be the best plan for our bucks to be able to help this situation, which is so needed?
So Bob reflects, I have to repeat it, so Bob reflects the reality, I think that, and it may be a quiet reality, it may be an unspoken reality that many of us have experienced family members, if not personally ourselves, but family members who have dealt with, sometimes poorly, sometimes more successfully, mental health issues. And so we know this personally, but we don't quite know where to turn. We only have $60,000, and that looks like very little in comparison to the $100 million or so that the state government just passed. But that $60,000 could make a difference. They don't call us the Catalyst Fund for no reason. In a particular place, it could be special and powerful. So you got any suggestions? We're all ears.
So I would say this. There's still a huge stigma attached to mental health. It's why it's always on the chopping block. There is nothing sexy about mental health. It's never going to be on the billboard, those sort of things, for good reasons. One of the things that I think we've learned in this pandemic is that our kids and our children, our adolescents are amazing. And you heard that from what Caitlin's talking about in terms of her program that she's doing out in Avon. I think the best bang for the buck that perhaps is not within the money that's going to go to the state is how do we build supports for our teenagers to support other teenagers. They're never going to be counselors. They're not going to be mini social workers by any stretch. But I think the more that we can help kids by empowering other kids to know signs of what they could be looking out for, to know what to do if their friend comes up to them and starts talking about things that they're concerned about, I think that's how we can create a real spider web that everywhere a child goes, they have those supports, and I think perhaps it starts with their peers.
Anybody else want to add in? Yeah.
Just want to definitely follow up on that. One of the things we realized during the pandemic is that having that peer support is critically important. And so as it related to COVID testing, to COVID vaccination, is having peers talk to you about why they're doing what they're doing made a tremendous impact. And so there are opportunities that are happening that can engage young people. So I know that the Born This Way Foundation through Lady Gaga has just started a new Be There certificate that has ability for young people as well as teachers to be able to engage in a program to learn the signs. And I think when you think about the change that can happen with $60,000, supporting something like that within schools or within specific schools could be something that could have an impact, where young people can talk to young people and break that stigma that exists around mental health services. And I would say that stigma, for sure, particularly in the Latino and Latinx and the African American community, is very strong.
You know, and it's interesting, I'm picking up kind of a theme here of the importance of community, whether it's communities of advocates that get to know about each other, or it's the legitimacy of an organization to which you turn, or the community that you can build among peers. There's a sense of that, and maybe $60,000 can find a way to community somewhere.
Can I add one thing real quick?
Yeah, please.
So, to piggyback now on you, one of the populations that we saw come into our emergency department a lot in the pandemic was our LGBTQ plus population, in particular our transgender youth, because during the pandemic, a lot of their community organizations shut down because of lack of funding or not enough staff. And that is a population that by their nature does not trust the healthcare system very well. And so that is a population that ended up in our emergency department because they just never had those other connections to get along the way. And I always think about if we had that network of peers, if we utilized Lady Gaga's foundation a little bit more, what that could have done to help stop some kids from needing to come to the emergency department because they had somewhere else to turn that they felt comfortable.
Can I just add to that? I think right now there's a national, organized, extremely scary, systematic kind of attack, and I'm going to say by the far right, in particular on LGBTQ folks. And they have playbooks that are developed at the national level and then come out into the communities. I mean, we were at an Avon Board of Education meeting, I think it was 2 nights ago, where really ugly attacks on this community and how the access to information that these students get in the schools and the support that they get. Extremely alarming, and it's life and death, you know, for some of these kids, or a life well lived versus a life of acceptance, and just kind of building on this theme of community, like the kids in the high schools especially, they get all this stuff much better than the parents do. I mean, they're amazing. And middle school, you know, as they go through puberty and when they, you know, this is where like awareness of all these issues come out, and there's sort of no guidance and support. We teach sex education, but we don't teach about race or all of these other issues that kids are confronting. And so having both the education and the youth support networks, I think is just absolutely critical on all these fronts.
Okay, Betty Ann. Okay, yeah.
I'm not sure who this question is for, but maybe Caitlin would like to take a crack at it. I like this idea of the peer-to-peer support and learning, and I haven't had a teenager for a long time, so what do you think the folks in high school, your friends and so forth, how versed are they in mental health issues? And assuming that not everybody knows everything about everything. What is the best way to, for peer-to-peer learning to take place? Who do you want to learn from? How would you like to get that information so that you can better help your friends?
So Caitlin, I got to repeat it so so everybody can get this. So the question, and it's to Caitlin, but I think everybody on the panel might have something to say about this issue as well. If the question to Caitlin is really how well versed are your contemporaries, are your peers in some of the mental health issues, and therefore how ready are they to help their friends from a position of at least some knowledge, some experience based. And then the ancillary to that, or that goes along with it, is that if given whatever knowledge or experience level they've got, how do we get them more? How do we get them better prepared?
So right now, like the conversation and the education, So right now, like the conversation and education about mental health is predominantly on social media platforms, and there's a lot of like misinformation. Can you guys hear me?
Yes.
Oh, so there's a lot of misinformation about mental health and like especially pertaining to youth. So I guess like right now, like in schools, there's not really education or like conversations about like what is depression, what is anxiety, what is stress. Like it's like we all know the terms, but it's just like, do we actually know what the definitions are? So, and like right now it's like, I guess there is like a peer-to-peer like helping that we do with like friends and stuff like that, because I know like a number of people who had to like talk down their friends from like committing suicide. Like it's like honestly like we're there for each other, but we just don't have the education, and we don't have the education to like talk somebody down or like to give each other support. And it has to come from a person of authority to like help us like with issues that are far beyond our years.
Okay. Anybody else have a thought, an experience?
Well, this makes me feel better because we were thinking about doing something for TikTok and mental health, so now Caitlin's making me feel a little bit better that could work.
And I would say, I mean, all of these things would have to have adult support. Yeah. To Caitlin's point, there has to be a trusted adult, a trusted person that these peer educators and can turn to for their own mental health, but also to turn to be able to bring those hard cases. And I think about like what you do in colleges, right? We teach resident advisors, resident directors in schools a whole host of information and resources and provide them with adult support. So how could we do that in a larger scale across high schools and even middle schools? I mean, I have a child that's in 5th grade, and they're already dealing, and they're talking about these issues, and they're dealing with it. And how can you expand that to have the older teens mentor the middle schoolers to sort of stop that cycle before it even continues?
Okay. We have another?
It kind of breaks my heart to think about teenagers having the responsibility of talking their friends down from suicide, but I know you're right, Caitlin. And that's part of what we have to feel, because you guys shouldn't have to act like, you shouldn't have to play that adult role. That's a lot of pressure I had on you. So thanks for raising that.
Hi, this is for Caitlin and Kim. I mean, when I was in school many moons ago, it was you study for tests. I mean, you have sports and you have your friends. It seems like what you're talking about is that socialization, that you know, you have your grades, you want to do well. How much is it affecting, and also with Kim, what we're seeing, the quality of them, you know, learning in school, but their courses, how much is it interfering, is it overriding versus actually what they're learning, and therefore does it hinder their kind of the future? And the kids who are not, who are kind of putting aside, say, there's no problem, you know, I'm good in sports, I get grades. What are you seeing, Kim, with your group or Kate? Have you noticed that the pressure of this is affecting your school and what you want to learn?
So the question has to do with the pressures that exist in high school environment, a competitive environment, also a very structured environment, but now with an extra dose of mental stress, partly by COVID, partly for other reasons. How is that affecting two things in some ways? How is it affecting what you consider the normal life in high school, but also how is it affecting the educational purpose of your experiences there?
So, as a junior, the biggest question you'll receive is like, what's next? What do you want to be when you grow up? Like all those great questions. But right now, as a student competing against every single student in the nation to get into colleges and stuff like that, you have to have perfect grades, you have to be on varsity sports, you have to have the clubs, you have to have all that. So like, for me and my peers, it feels like you're at, like, from around like 8th grade to like 12th grade, your activities and your time and all your free time is spent trying to build up your resume and trying to build up for your future that like after college that you'll receive. And it's like, and it's just you don't have a break because it's like you're fighting for something that you're not even guaranteed. And it's like, how do you even figure out who you are? What is your identity? What do you like? And it's just, you don't have like the foundation of identity to like keep moving forward.
Yeah, I'm just kind of building on what Caitlin has said and sharing a couple of things. I think kind of there's a fundamental question that we need to ask as a society is what is the definition of a successful education and what do we really want our kids learning? Do we want them getting A's in math and science and all of that, or do we want to be teaching them to be inquisitive, to learn how to learn, to feel confident, to know how to work with many different people from sort of all over the world in different walks of life to solve these massive problems that the next generation is going to be inheriting. So I think that's the question we sort of want to be asking, and I know I'm shifting your question a little bit. And so, and mental health ties into all of this because it's all about self-confidence and feeling good about yourself and how you engage with the world, right? The other thing that I would like just to share is that this kind of comes back to the equity piece of all of this, is that I think we've all bought into an assumption that particularly the suburban schools, the Avons, the Simsburys, the Glastonburys, whatever, these are the desirable school districts, right? We bus kids from Hartford into these suburban communities. And I actually believe that we may have bought into a myth that these are actually top-notch school districts where we all want our kids educated. And I'm a bit of a data geek, and I've really tried to dig into where is the long-term data that shows life outcomes of students that have been brought into these communities from outside, how well are they doing, and it's frankly not there. So you know, we really do need to ask questions about this, and I think, you know, this is why we need to build community to be able to, you know, really understand each other and make the experience better for every kid. And so it's fundamentally questioning our values as a society and what is important to us as human beings and how do we want to engage together. And that may not have been exactly the answer that you were looking for, but it's kind of how I think about that question.
And just a comment, so I've heard the need for community and peer support. I heard earlier that there are a number of towns like Avon, that might be in leadership roles as Catalyst, representing 28 different communities. How does one go about the peer training and community Catalyst or one of the organizations would be to look at possibly some kind of regional training for peer support, linkages and networks amongst these various existing groups. I'm not sure who that is, if that's Connecticut Children's Center or another organization, but it sounds like the needs that have been identified are fairly universal. Is there a way to package that and organize it for peer support training, both from professionals, people in authority, and students, that process, that thought may grow over a period of time rather than being 28 different silos in the greater Hartford area?
So the question, and it's to all of you, and I'm probably going to push this a little bit. The question is, Hartford Foundation represents 28 communities in the area. We've come up with ideas. We've heard them from you as well, that peer relationship support is a really key factor and could be a very helpful factor. How do you create that kind of peer support or training for that kind of peer support across 28 somewhat different towns? Let's just say 28 fiercely independent towns. That's whether they're different or not, yeah. So let's see, go ahead. I think you should start that off.
The state has sort of sectioned off for different issues into regions. And so we do have what used to be the North Central Regional Mental Health Board, which is now called Amplify, and they work across the region as well. They fund what are called local prevention councils, which communities have, so that may be an opportunity working through them through that, where these are groups that are working often within schools, within communities, around substance use, including mental health issues there. I mean, that's potentially one way to work and to have a greater impact, where they can bring their local prevention councils together and do the training, and then they go out through the local prevention councils and reach out to other groups. You can also potentially work with them. They do mini grants, and working with them to maybe, again, catalyze the funding and be able to have them make this a priority for their funding. And then this would also entice the local prevention councils to participate, because there's an opportunity to get a mini grant through the process to do this, both not only through the Hartford Foundation and the Catalyst Fund, but also through potentially the local prevention fund. So if there's an opportunity for them to say that our funding, we can match that, and now we have $120,000 to give out to the local prevention councils. That could be something that I think would get to the region, since you're focused on the region.
Yeah. Anybody? Yeah, go ahead. Melissa?
Yeah. Just a thought on this. When you're talking about issues like mental health, equity, race, these are all topics that we're not really supposed to be talking about, right? And we need to change that. We need to be talking about this stuff in really constructive ways. And one of the things that we are really careful about as a group is kind of not to try to come off as a bunch of like wacky radicals that are just, trying to push stuff. Like, we're very, very mindful and very systematic about how we think about communicating our message. But one of our big challenges is getting folks to be comfortable having conversations with us so that we can grow that community out. And sometimes it's like, you need people, whether it's a political leader that people might look up to, or a community leader, maybe it's a baseball player, so this networking and community building needs to be a combination of folks who are in roles of authority, folks that people can want to respect and want to be a part of, to really push us towards that, that community building and having those conversations that we're all told we're not supposed to have. And so kind of how do we build those support networks, and how do we share that information among ourselves to turn the system around?
Okay. Thanks. Betty Ann, you're going to one. Okay, here we go.
Hello, everyone. So I was wondering, I don't know if you are familiar with mental health first aid, and I don't know if that could be a solution. I know it's a great program that really teaches people the basics of what is mental health, what are the different illnesses, how do you talk to someone that you notice in your office or in your school that is struggling, what language do you use, what language don't you use. So that may be something that the foundation could look at as a possible opportunity, because it's like first aid for mental health. So, you know, a lot of us are certified in first aid. We should also all be certified in mental health. And it's an 8-hour program, and I think it's really valuable. So I'm curious if any of you are familiar with that up there.
So the question is, there's a program apparently called Mental Health First Aid, an 8-hour program that you can go to and be certified, or at least learn. Are you familiar with it, and do you have comments about it?
Yeah, so Mental Health First Aid is a great program. I wonder if one of the things that, particularly if you want to do the biggest bang for your buck, is really thinking about sort of almost like a train the trainer model, where you take peers, you train them to train others, they then train on others, and it sort of becomes like COVID, right? One person starts, it kind of, sorry, you can use any analogy, right? It starts with one person, and then it kind of spreads out. I love things like mental health first aid, but it requires somebody to get there and sign up and do the thing. And I wonder if there's a way to spread it out in a different way by training our kids to train other kids, to train other kids, to train other kids along the way. But mental health first aid is a great program.
And I think that's potentially where the LPCs can be useful, because schools are involved, community organizations are involved. It's not just based in one place. And so some communities have some that are more active than others, but I think there's enough in this area that you could potentially have a good group of people. And again, you have mental health first aid, you have the work that Lady Gaga's Born This Way Foundation just released maybe a month and a half ago, with their certificate around learning around mental health and how to support people. So I think there's lots of programs out there that can be used. Some are free, some are low cost, but that will allow the work to go beyond.
Okay. Yeah.
Hi, I have a comment for Ms. Garcia and Ms. Garcia-Stevenson and Ms. Stevenson, and a question for Dr. Santos and Ms. Arroyo. I just wanted to thank you for lifting up the comments about the work that you're doing in your local community, particularly with the leadership. I'm also someone who just rolled off the Board of Education in my town, and your mention of the playbook that's happening nationally is absolutely accurate. It's intensifying not just by the month, but by the week. And currently, the biggest focus is moving in the direction of social emotional learning, so that it can really weaken the underpinning of all of the mental health supports that affect children nationwide. So the things that we're seeing that are so helpful are the parent groups and the student groups are actually doing the community level education, so that people can become aware of what's happening, and also can be a barrier for some of that for your leadership. So thank you for that, for your work. And the question I had for
So let me summarize the question a little bit, and this fits in with something we were talking about at dinner, that we've got all this money now that the state has just passed, and it's not as if you can go buy a mental health professional at Home Depot and have them up and active in 5 minutes. There's a pipeline. The pipeline takes a certain amount of time. Some people have said as much as 10 years. Are there things that we can do? There are things that could be done to speed up the pipeline, to not relax the standards necessarily, but relax any kind of onerous stuff that gets in the way, that exacerbates the time length. What might be done? Are there ideas for that?
Yeah, it's such a great question, and I think it's something that the state has started to look at, particularly when it relates to our trainees, so our social workers before they're fully licensed, our psychologists before they're fully licensed. I think some of the challenges with them is, where do you go for your continued training? Because for some businesses, they could be an expense because they can't oftentimes bill for their services. And it's the part of mental health that we don't like to talk about, is that if we don't get paid, we can't continue to offer the care. And so we've seen some movement towards perhaps allowing more ability for people to bill for their time and bill for their services, which then creates a greater workforce, because you have more people that are out there and being connected to organizations that maybe in the past would have been like, I can't take on a trainee, or I can't take somebody before they're fully licensed because of that billing aspect. So we've seen a little bit of that kind of going forward. But I still think even with relaxation of some things around psychology, social work, even psychiatry, I still don't think it's going to be enough. And we really do have to get into some of those peer mentorings and other kinds of ways to connect with families.
Definitely agree with everything you've said. I think the other thing you're talking about, payment. One of the challenges that I often hear about from colleagues and friends, and then just from reports to stay up on these topics, is the fact that there are providers, but they're not taking insurance, and parents and family members and caregivers can't afford to self-pay. And so if there is opportunities to do work and advocacy around that, in terms of the amount of paperwork that things take, and often when you're thinking about some of these services, it's not an organization, it's an individual provider, and that's a lot of work to do billing and then to see patients and clients. And so I think there's likely some work that can happen there to expand the pool of individuals that will take insurance. But again, it's just one piece of a puzzle. It's sort of a comprehensive piece. We have to work on maybe bringing more in through licensing, working on bringing more people into the system that can take insurance. And then I would also say, looking at the long-term piece of this is, again, as Dr. Santos says, the issue of stigma, that this, if we're not talking about this on our own and challenges you may be facing, do you even see this as a career path in the future? And when we're thinking about children, especially here in the state of Connecticut, the last census data that was just released is that 50% of kids, a little slightly over 50% of kids under the age of 18 in this state are now kids of color. And so how do we prepare the pipeline to address those children? Because when there's incongruence between a provider and a client, sometimes the relationship doesn't work, and we need to sort of start thinking around that as well.
If I could just say one other thing on the reimbursement. So the reason why also a lot of providers in the community don't take insurance is because reimbursement is so bad. I would go bankrupt if I was a private practitioner seeing kids with Husky insurance and just billing for my time. And I think we're not that far removed from mental health parity laws, where we've had to actually have a law to say you have to pay for mental health care. You have to treat it like it's a medical condition. And I think until we can also do some work around that in terms of what the reimbursement is, I think that we're going to continue to have a lot of practitioners that are not going to take insurance because they can't in order to sustain a practice.
Lydia.
I think we have time for one more question. If there's someone who, after all this information, still has a question bubbling up.
It's true. My search is not good. Say something for $20.
Thank you. It's been a very enlightening conversation. One question I have is the role of social media. I have a teenage daughter and watching her with her friends. It seems like it could be playing into the mental health issues in the teen
So the question, and I'm surprised it hasn't come up earlier, to be perfectly honest, is one about the role, the effect, the power of social media, and whether it is a power that has had a positive or a negative or perhaps a neutral impact on the mental health of our young people. And I want Caitlin to see, because you mentioned social media a while ago. I want you to just give us an impression about what your social media experience and mental health is.
So
Get the microphone real
Sorry.
close.
So social media is gonna give you an extreme amount of information, even information you don't want. I don't really care if you're going to Turks and Caicos with your friends to go on vacation. Like, it just, I guess for the social aspect, it just makes it evident that you didn't get invited to a social event, or you didn't get invited to the gathering or the party or something like that. Like, it makes what's going on in school or wherever you go for the majority of your day, like those emotions are just, you feel those emotions just the same on social media, because you just see that, oh, you're not invited, you're not included in the group. But at the same time, if you're feeling depressed or something and you don't know what that is, or you don't know what it feels, and you don't know how to get extra help, you can go online and you can research all that stuff. So it's a positive and a negative, and it also just shows you're not going through this by yourself. There's other people that are dealing with anxiety and all other mental health issues. So it's a positive and a negative, and I guess it's, at the end of the day, you have control over what you see, and you have control over how much time you spend on social media. So yeah.
Okay, great. I saw some heads nodding down at this end of the table too. You want to weigh in on that?
Yeah, I think social media has its advantages, and I think it has its disadvantages. I mean, I would never want to go back to high school, but at least when I was in high school, if my friends didn't invite me somewhere, I didn't know. Now I have like 7 social media platforms to know all about it, which is hard. But I think at the same time, what we've seen is for some kids, for some, particularly our transgender community, that is oftentimes the only place that they get support, or they feel like that other people understand them. But I also think, regardless of whether or not it's advantage or disadvantages, one of the things I make our kids that I work with at the Children's Hospital do is actually show me how much screen time they do, because the iPhone, which almost everybody has nowadays, actually tracks your screen time. And not only your screen time, but what you're specifically spending your time on. So if you have an iPhone and you've never done that, you should look at yourself. It's very fascinating. And to see the number of hours that kids spend on social media, I think is the bigger concern. And I think regardless of the advantages or disadvantages, I think just what does being on social media take away from other activities that you could be doing, I think is the bigger question. Because I do think, as Caitlin said so well, it does have its advantages and disadvantages.
I think I'd like to add to that in the sense of, we have to work with our youth around media literacy and health literacy. We did that with tobacco, with the Truth Campaign, and that campaign, along with laws and community work, it's not just one thing or another. I usually look at these things sort of as a 3-legged stool. You have big P and little p policy, you have community outreach, and you have media. And so we have to work on all of those. But one thing I don't see a lot of, again, having a 10-year-old who's itching for a TikTok account, how do we teach our children media literacy and how to gauge what is good information from what is not good information? Because there's not we don't have the amount of money needed as public health to counter all of the misinformation that is out there. But we have the tools to educate our young people and to educate parents about how to discern what you're consuming, to be able to find the resources that you need that are helpful. And I think that's one thing that is needed, very much so.
Okay, so we end by confronting a multi-headed monster that's much larger than we have the ability to manage, but we also have been at the level of community as well, and building community among our respective groups, and how important that is. So I want to thank each one of you for being here tonight and sharing with us and answering the questions, excellent questions that our people can come up with. So Liany, Elba, Arroyo, and Melissa Santos, and Kim Stevenson, and Caitlin Garcia-Stevenson. Thank you all very much for your time. So let's give them a round of applause. Again, I want to thank the people who put this together. Actually, realistically, I want to thank all of you, because we went through a process this year a little bit differently than we have in other years to come up with this topic. We went through a two-step process. We asked everybody what they thought. We culled it down. We let us vote 2 times, and we came up to this point. And intriguingly enough, we were ahead of the curve, weren't we, in terms of glomming on to this issue as an important, critical one that's somewhat under the radar, but definitely needs our attention. So all of you deserve to pat yourselves on the back, which my mom said was a great way to break your arm. So I don't want to do that. Anyway, for you guests, I hope you're interested. If you have other guests, other people who might be interested, we would love to see the Catalyst Fund grow, the Catalyst population grow. Obviously, when you come to these kinds of events, you learn a lot, and you see where you and others can plug in to make a difference in our community, which is what we're trying to do for the benefit of our community, as are these wonderful panelists in their own ways, each in their own wonderful ways. So thank you for coming, and I think we are done for the evening.